Welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to discuss about a case which is of thyroid gland, but the thyroid gland may not be told in the question from anatomy, and thus with the case you have to identify that it is talking about the thyroid gland, and secondly there will be anatomical questions which will be based on the thyroid gland. So let's go through the case. So we have a 55-year-old lady who was presenting in the surgery OPD with a midline nodular swelling in front of the neck. The swelling was moving with deglutition. On examination, it was found that she has tremors on the outstretched hands. Her pulse rate was 110 per minute. She had slight eye bulge. She complained of weight loss in the last few months and felt feverish. Which organ is involved? So coming to the questions, so you have to identify that it is thyroid from the first year itself, okay? And you have to explain in detail the coverings, the parts, the relations, blood supply and clinical anatomy of the organ concerned. So once we have gone through the case, we have identified the thyroid is involved. Please write clearly the thyroid organ is involved in this case, because that will carry 1 mark in your essay. So identification of the organ is also very important in this particular question. And as it is an essay question, you have to explain in detail the position of the gland. Definitely we have to talk about the thyroid gland, its position, all the coverings, and also the relations are extremely important because thyroid has lot of clinical and surgical significance. Blood supply of the gland also has to be gone in detail with the diagrams. So I have made some hand-drawn diagrams for you which may be very easy, and it will be schematic more or less, so that you can draw these diagrams in exam easily. You can practice and draw easily. And also the clinical anatomy of the organ is extremely important in this question. So now let's go through so you have the hyoid bone over here. You have the cartilage which has been shown over here. So you can see over here, this is the hyoid bone. And there is a membrane which will be actually extending between the hyoid bone and the thyroid cartilage. That is called the thyrohyoid membrane. So this is the thyrohyoid membrane. And there are structures which will be piercing that. Okay, fine. So once we see the thyrohyoid membrane and the thyroid cartilage, so below the thyroid cartilage, you are getting the cricoid cartilage. So this is the cricoid cartilage, and we have the cricothyroid membrane. Okay. So this is the cricoid cartilage which has been already mentioned. So now you can see over here the thyroid gland is having, this is lobe, this is one lobe, this is 2 lateral lobe, and this is the isthmus of the thyroid gland. So whatever I have explained, it is shown over here. Here we are showing the vertebra extent of the thyroid gland because the apex, so the apex is starting posteriorly. If you correspond it, then it is lying at the level of C5, and the lobe from the apex, it goes down. This is the base. So this is the apex, this is the base of each lobe, and it goes down up to the vertebra level T1. So it is extending from the vertebra level C5 to T1. So each lobe is extending like that. Now you can see over here that each lobe is being connected by an isthmus, and I told you the isthmus is extending between 2nd to 4th tracheal rings. So what you are seeing over here, these are all tracheal rings. Okay, so 2nd to 4th tracheal ring. The isthmus is extending. What about the anterior extent of each lobe? So each lobe is extending, the apex is reaching up to the oblique line of the middle of the thyroid cartilage, and the base is going down up to the 5th tracheal ring.